So the first thing I would do as president is fix the Affordable Care Act, because it was a good law and it's been destabilized by the Republicans. And I think it could be shored up really quickly, and that would help Americans right away. I think that can be done in the first month or two of my administration. But then what I would want to do is create a universal healthcare system where every American had healthcare as a right. We can afford it. I think it's a basic human right. And I really do think it's smart economic policy. There are so many Americans right now who are shackled to their jobs, and they'd like to either start a business or go get some training so that they could improve their career, but they can't because of healthcare. The way I would do it is I would leave Medicare alone because it works, people like it, and there's no reason to mess with the part of healthcare that actually works. Then I would create a new program that people get from when they're born to they're 65. A new federal basic healthcare program. I'd roll Medicaid into that. So people would have healthcare as a right from when they're born to the end of their lives. But they would be allowed to get supplemental plans, just like people do with Medicare. So they have their basic government plan, but then they'd go in the market and they'd get all kinds of supplemental plans, which would be offered by private insurance companies. And I'd also allow people to not take their government healthcare if they don't want it, get a small tax credit, and use that to buy their own healthcare. And that whole program would be paid for by eliminating the corporate deductibility of healthcare, which is the largest tax exemption that we have right now. And you wouldn't need it anymore, because if we had a system where everyone had healthcare as a right, as a basic right, they'd show up at a company, they'd have their government healthcare. The company may want to give them better healthcare and may negotiate a group supplemental plan for them to buy into as an employee, right? But you wouldn't need the deduction anymore because the employees would show up with their basic, almost major medical. So that plan would give everyone healthcare as a right from when they're born to the end of their life. It gives them choices, which the American people absolutely want. It keeps private healthcare as part of healthcare delivery, which is really important because Medicaid and Medicare actually don't pay the cost of healthcare. Medicaid only pays 80% of the cost. Medicare pays 95% of the cost. Private insurance pays 115% of cost. So there's no evidence to suggest that if we had a government-only payer, like single payer, that the government would ever pay enough. And that would lead to reduced quality and access in healthcare. So my system, I think, is the best. It's fully paid for. It creates universal healthcare, and it gives the American people the choices that they want with their healthcare.